Hi everyone, welcome to this side event, Pathways Towards Climate and Health Justice, towards a just and resilient health system. Thank you for coming. My name is Deivanayagam. I'm a Professor of Global Child Health in University College London and Director of the Race and Health Group, a non-profit organisation. Our goal is to reduce the adverse effects of discrimination that leads to poor health. Race and Health is a collective of academics, activists, artists, policymakers, grassroots organisations and individuals, and our current focus is on climate and racial justice. Thank you for joining this event today. We're going to start with a short film describing our work that was led by our partners in Brazil, the Philippines and Uganda. We'll then have some high-level talks followed by a panel discussion. We also want your involvement. So we have a question that will be available through Menti online, and you can submit questions to us. And we will go through those as we go through the panel. The images from the slides you'll see throughout are from our comics produced by young people in Brazil, the Philippines, and Uganda. So first we have high-level talks. We have Honourable Professor Akin Abayomi, who's a Commissioner for Health in the Lagos State Government. He's a specialist in internal medicine, hematology, environmental health, and biosecurity, and has worked in several countries around the world in these fields. He's also the chair of the H3 Africa Consortium, Data and Biospecimen Access Committee, and principal investigator of the Global Emerging Pathogens Consortium. He's an esteemed member of the African Academy of Science Committee on Data Governance. Professor Abayomi, please could you give us your presentation? Thank you. Oh, sorry. We'll show the film first, then we'll go to your presentation.
Está muito quente agora. Quando tinha mato aí era bem refrigerado, né? Por isso que eu planto muita planta assim. É por isso, para casa do calor, né? Mesmo assim dá muito calor.
Parang hindi ko ma-imagine yung panahon ng klima ngayon. Parang sabi ko, malapit na yata tayo sa FPS.
Badde gatusumbuyira ddala nnyo nnyo naye oluvannyuma olw'akasasiro atubeeramu ate nga oluusi kesisi eremerera okutuuka mu bitundu byaffe okutumugyamu.
Está havendo muito assim, febre, pessoas que criam seus bebezinhos sofrem com negócio de falta de ar, diarreia, muitas das vezes vômito.
Tulina obuzibu obw'amazzi gano bw'omulaba ng'omwala guno okubanga giyita mu nzija zaffe ng'ate tegirina wala wagigina yita ne tufuna obuzibu gituviiriddeko obulwadde olw'abaana baffe abalwadde ebirwadde ng'ebiddukano bakyala baffe kubanga gye bagenda kati nga bulaba ekiyigo.
Na comunidade, a questão da saúde na comunidade, ela é um pouco precária. Primeiro começa porque nós não temos um posto de saúde, que é o básico. Nós não temos um medicamento básico, nós temos um ACS na comunidade, que faz o mínimo da tarefa de um ACS. E o atendimento em si da saúde, quando alguém adoece, somos nós por nós.
Ayun, binibigay sa amin kung ano yung mga dapat na dito sa samahan naman namin pagbibigayan. Wala siyang tulak kabigin, ganun.
campaign na lang namin is linisin yung mga kanal. Kailangan ito yung linisin natin para maibsan yung pagkakaroon ng maraming lamok at pagkaroon ng maraming dengue at mga leptospirosis.
Thank you very much. So, as I mentioned before, this was led by partners in Brazil, Uganda, and the Philippines, YACAP, University of Sao Paulo, and Climate Operation. So now we'll move on to high-level speeches. Professor Abayomi will speak on how health systems function across the world and what is Lagos State government's plans for their health system.
Hello? Can you hear me? Okay, good. So I'm just going to talk very high level about what the roles and responsibilities of government are. And I think, you know, the WHO has set the criteria for delivery of healthcare. And of course, the goalposts are always changing, and we need to change with the goalposts. But essentially, the WHO says that a government's responsibility to its citizens are to provide activities whose primary purpose is to promote, restore, and maintain health. And so the facets of that are essentially around providing those services, raising the money that can be spent on health, and I'll speak a little bit more on that in a second, pay for health services, and of course, regulation. So in Lagos State, a 30 million population, high density, mega city, low-lying coastal, we're extremely vulnerable to climatic shocks and other biological antecedents. And so it's important for us to build a very resilient health system, irrespective of whatever the shocks might be. But we do know that climate change is upon us. It's not going to take us by surprise. And so therefore, as we build these strong health systems, we're paying a little bit of attention to some of the specifics of climate change. And we've already done our modeling in Lagos, which shows that climate inaction across multiple sectors is going to be very, very expensive. And so a stitch in time saves 9, and we've developed a very elaborate climate roadmap that is going to essentially climate-proof this megacity, this model megacity in Africa over the next 10 to 20 years. But what do we do as government? We obviously provide services. We're paying a bit of attention to climate-proof infrastructure. We need to build a competent workforce and train them specifically in not just about climate change, but other biological shocks. We need to, of course, disseminate good and clear information in multiple languages to all sectors of society. We need to be able to control and regulate medical products and, of course, regulate clinical services. In terms of the opportunities to strengthen the healthcare delivery sector, we're looking at both the tangible and the intangible. Of course, the tangible relates to infrastructure, human resources for health, equipment, and the consumables that they use. It is important that we are operating in an internationally benchmarked environment. And I think this is the role of governments, to ensure that their constituencies are receiving medical interventions that are not made up or non-evidence-based, and they conform to international best practices. On the other side, and that speaks towards the intangible, which are the quality of service, the quality of interventions, and soft things like hospitality and etiquette. So we've spent a long time redesigning our infrastructure with a clear aim of climate change. We're noticing that Lagos is getting hotter, is getting more subject to biological shocks, outbreaks of all kinds. Because of the high-density nature of Lagos, any kind of contagion is spread very quickly, whether it's waterborne, airborne, or contact-borne. And so our medical facilities must adapt to these changing environments. So we're talking about heat. We're talking about the rising cost of fossil fuel. In Lagos and in Nigeria, we found that the cost of fossil fuel has gone up by several-fold in the last 6 months. We're finding the environment hotter and more subject to climatic aberration. So we've spent about 3 years developing blueprint designs for our primary healthcare sector and our secondary healthcare facilities. And this slide just shows you one of those blueprints. It shows you how we've paid attention to cool buildings, low carbon footprint, and renewable energy, with the roof there being completely solar paneled and creating a false roof which protects the main building from the heating effect of sun rays. We've also adopted an inside-outside waiting room structure so that when clients come to these facilities, they're not in crowded, under-ventilated rooms, which therefore reduces the opportunity for hospital-transmitted infections. So when it comes to financing, there are multiple sources of financing. Obviously, the center there is the government's budget, and we're trying to conform to the Abuja Declaration in Africa, which says that you must spend up to 15% of your budget on health. But there are other opportunities. There is, of course, making health sector spending efficient, and to do this, we are digitalizing our entire health sector to make sure that we can cut losses and wastage and introduce a more efficient way of delivering healthcare services. We obviously want to partner with the private sector to ensure that we are creating a resilience to manpower and a higher standard of healthcare delivery. We're introducing a health sector insurance, social health insurance. Up till now, it has been voluntary, but we've just passed a new bill which makes social health insurance mandatory. That's going to make it much easier for us to create the pool of funding that's going to support the budgetary allocation to the health sector and provide sustenance to both the demand side and the supply side. And obviously, we're always open to donor funding, and we have a large number of high-impact donors operating in our health space. Mr. Moderator, this is my last slide. The role of government is to maintain a central planning governance framework. And there, as government, we are responsible for the healthcare delivery to our citizens. And so we must pay attention to our regulatory function. We must leverage on all kinds of opportunities. We must make sure that there's demand-side financing through the methods that I just described. We must ensure that we are operating an internationally benchmarked standard. We must give clear communication to both the citizens that are receiving health and to the personnel that are delivering the health care, that there are no arbitrary, confusing areas of healthcare delivery. We all know that there is a great movement of medical personnel out of Africa and out of India and other developing environments into the more developed Northern Hemisphere countries, what we describe as brain drain. So it's essential that we create the enabling environment for our healthcare personnel across the cadres of service delivery to make sure that we're reducing what we describe as the push factor. We can't do much about the pull factor, the factor that pulls people to greener pastures, but we can do something about the push factor, which is essentially decreasing or improving the conditions of service for our healthcare personnel, which comes to the facilities in which they work, the remuneration packages that they are receiving, and the respect that we should accord our healthcare professionals. So essentially, we're using these high-level principles in Lagos to strengthen our healthcare systems and make sure that we can deal with all shocks, climatic, biological, and human resource shocks that an environment may experience in its governance life structure. Thank you very much for your attention.
Thank you very much, Professor Abayomi. It's wonderful to see the principles and then the actions in one of really the largest cities in the world. So thank you very much for describing that to us here and how we can be resilient and construct the health system to be resilient to climate impacts. Our next speaker is Ms. Christina Romanelli, who unfortunately can't be with us in person today, but should be joining online. Ms. Romanelli is the Programme Officer on Biodiversity, Climate and Health at the World Health Organization. Prior to this, she managed the WHO's Joint Work Programme on Biodiversity and Health with the Convention on Biological Diversity for over a decade. She served both as an expert and a resource person for the Intergovernmental Science Policy Platform for Biodiversity and Ecosystem Service, and she was the principal lead and coordinating author of the WHO's State of Knowledge Review on Biodiversity and Health and Human Health, and has led the development of Biodiversity Inclusive One Health guidance adopted at COP14. Ms. Romanelli is going to give us an overview of climate and health progress at COP27 with a focus on racial justice and climate justice. Thank you.
Thank you very much. Can you hear me?
Yes, we can hear you.
Wonderful. Thank you very much for inviting WHO to the table and to His Excellency, the Governor of Lagos, for this really inspiring example, actually, of climate resilient healthcare facilities. You know, as His Excellency really made clear, climate change is really not only about sustainability. It is a quintessential health issue. And for millions of vulnerable populations, it's also an existential issue and one with deep links to social justice, because those populations that are most vulnerable to the impacts of climate change are often those least responsible to the unprecedented pressures we're putting on our planet through resource extraction, fossil fuel combustion, land use change, pollution, biodiversity loss, and other key environmental determinants of health. Combined, these environmental determinants are really responsible for approximately 1 in every 4 premature deaths from avoidable environmental factors. But not everyone is affected equally by these impacts. Vulnerable and often marginalized populations tend to suffer the greatest health burdens and are those that are least protected by social protection mechanisms, including access to clean water and sanitation, to healthy, safe and nutritious foods, to clean air, to a healthy environment, and to healthcare, of course. So clearly, climate change is both a health issue and a social justice issue. Yet, even at COP27, issues such as access to clean energy, sustainable transport, healthy urban environments, and to climate resilient healthcare remain underrepresented in negotiations, despite the strong health arguments that really, in my view, speak for themselves. For example, if we consider the 7 million lives lost prematurely every single year as a result of exposure to air pollution, or the heavy health burdens borne by millions more who suffer from food, who suffer from other forms of malnutrition, or exposed to zoonotic, vector, and waterborne diseases that are amplified by climate change and by environmental degradation. That being said, we all some progress has been made at COP by bringing the conversation, for example, on But decision makers must also considerably scale up ambition and investments toward a more sustainable, equitable, climate resilient future that is predicated on the human right to health, water, clean air, and of course also to the new internationally recognized right to a healthy environment. So, you know, we often see that some of the greatest progress toward aims such as these is made at the margins of the negotiations, isn't necessarily embedded through new partnerships, through new alliances that can bring us closer to these collective commitments. And one such example is the commitment to a clean and renewable energy transition and to climate resilient healthcare facilities. These transitions can and should provide tangible community benefits and should be aimed at correcting the underlying inequalities that are really built within our current systems and should help redress the inequities faced by young people, by women, by marginalized and racial minorities, by indigenous peoples within that system. So policies, mitigation and adaptation plans, and finance must also be inclusive and ensure that the voices of those most vulnerable are not only heard, but really embedded in these climate initiatives. So we are seeing, I think it's important to note that as the example we've just seen a moment ago, we are seeing some seeds of hope and promise at COP27 through some forward-looking climate resilient approaches to a just transition from fossil fuels that can both help deliver tangible co-benefits to health and be rooted in social justice by alleviating energy policy or increasing access to quality climate resilient healthcare. I'd like to give an example of that because WHO is really working with countries to lead by example and to support you in the endeavor toward a climate resilient and low carbon sustainable health system. So for those who aren't aware, at COP27, we were very proud to announce that WHO is supporting now 62 countries through the newly launched Alliance for Transformative Action on Climate and Health, the ATTACH, to build climate resilient and sustainable health systems and to promote the integration of climate and health into respective national, regional, and global plans. And among the 62 countries that have made commitments under ATTACH, 20 have also set a target date to reach net zero carbon emissions from their health systems before 2050. And we've helped them to identify some of these cost-effective interventions to get to that goal, which can range from early warning systems to the establishment of early warning systems or more resilient solar-powered healthcare facilities. So I think right now, we have a very tangible opportunity to scale up ambition and funding for health adaptation plans, for designing mitigation strategies that also support health equity, to join up planning for climate, health, and development, to mandate monitoring of health impacts through an equity lens, and really to make a central argument for achieving climate equity and social justice while meeting our Paris commitments. So at COP27 and beyond, I'd like to close by saying that please rest assured that we at WHO are very, very much committed to working with all of you in this room and outside of it to support you in your endeavors and commitments for climate justice, equity, and healthcare resilience. Thank you so much for your time, and I wish you success in these deliberations. Thank you.
Thank you very much, Ms. Christina Romanelli, and thank you for joining online. Really appreciate your comments and really the position of the WHO in these discussions. As you've laid out, the social justice elements of health are fundamental to improving the health of populations around the world, especially the most marginalized people. So now we're going to move on to the panel discussion. But before we do that, just to remind you of our Menti questions, what are the steps that need to be taken to achieve a just and resilient health system? The Menti link will be available on the screen, and you'll be able to submit your questions and ideas for this. So next we're going to move on to the panel discussion, where we talk about what a just health system is and how that health system can be resilient to climate impacts. So as was described by our first speakers, climate change is one of the greatest threats to human health. But as we know and are increasingly finding out, it doesn't affect all people equally. Those who are the most marginalized, the most minoritized are already affected the most and will be affected increasingly by climate change. These are the people who have contributed the least, the people who may live in the poorest parts of cities or in the poorest countries, or who may be persecuted because of their race, ethnicity, skin color, indigenous status, religion, or migratory status. And on a higher level, the most affected countries are not the ones who contributed to climatic change in any significant way. Countries in the global north represent 14% of the world's population, but are responsible for 92% of historical carbon dioxide emissions in excess of safe planetary boundaries. This relates to structural discrimination, racism, and colonialism. What are the health consequences? As described by Ms. Romanelli, it can be dramatic effects from floods, hurricanes, typhoons, cyclones, but also the much more insidious changes to the climate that all affect health. They can be on an individual level, most obviously different kinds of trauma, but also on a system level, and hearing about, in particular, the Lagos health system and how it's been constructed to help prevent some of these impacts. In this session, in COP, we learned about many different systems, the water system, for example, but here we're going to focus on health, but health in its broader sense, so not only hospitals and clinics. We'll discuss what a just and resilient health system might look like and barriers to achieving this. So we have 3 speakers on the panel. We have Dr. Deivanayagam, who's a junior doctor, academic and activist specializing in public health in the UK, who works on environmental inequalities and racial injustice. Abby writes and organizes for racial equity, abolition, and anti-extractivism as part of the Race and Health Collective in UCL. She's part of the Health for a Green New Deal campaign, mobilizing health workers for a transformative Green New Deal, and is co-founder of the People's Health Tribunal, a forum for deep listening and radical reimagining of health, with stories from the front line of climate violence and extractivism. We have Dr. Titilope who's the General Manager and Chief Officer of the Lagos State Environmental Health Protection Agency, where she's responsible for the implementation policies aimed at protecting and improving the environment in Lagos. Dr. Fasawe has driven a number of environmental and sustainable projects with success, including the Noiseless Lagos campaign and a ban on single-use plastic bags campaign. And finally, to my left is Ms. Titi Akosa, the Executive Director for Center for 21st Century Issues, is a gender activist, environmentalist, community mobilizer, and a defender of vulnerable persons. She's trained in law and sustainable environmental management and is a member of the Nigerian Bar. While Titi has worked at international and subnational platforms on issues relating to governance, health, environment, climate change, and renewable energy, poverty alleviation, and women's empowerment, she's particularly vocal and passionate on issues affecting her local community. So thank you very much to my 3 speakers for joining us today. My first question, which I will direct to Dr. Fasawe initially. What does climate and health justice mean, and why are health systems important to achieving this?
Good afternoon, everyone, and I'm glad we're having this conversation. It's been my passion constantly to exaggerate and start to make noise about the nexus between health and the environment. Climate justice, to me, as an African and as a government official in Lagos State, is simply relating our environmental standards, the quality of our environment, directly to our health indices. And it is, in doing this, it has become obvious that a lot of people are marginalized, people are underserved, especially the poor people living in the coastal areas and the traditional ones still in the villages. And as a medical doctor, recently turned environmentalist, my mission really is to advocate for climate justice, not only by picketing at government, because I work for government, but by educating the people. Not only educating the people, making sure that the government puts in place necessary amenities. From the video we watched, it was heartbreaking to see that 7 million people die every year from air pollution in the world. And in 2021, in Lagos alone, we had 30,000 die from air pollution out of this 7 million. And out of these 30,000, 75% were children. The video we showed here spoke about shortness of breath, diarrhea, typhoid, malaria. All these things are environment related. When you continue to treat a child for asthma, pneumonia, and you don't provide alternative clean energy for the mother to cook, and the mother is still cooking with firewood, you don't address those issues, then we're not thinking climate justice. Climate justice is what we're doing here. We're addressing those issues through government and by educating the vulnerable society.
Thank you very much, and thank you for bringing it down to that very local level with real examples of children, mothers who are affected by this, and children who are dying in Lagos. Ms. Akosa, can I direct the same question to you? So, from your perspective, from a legal angle, what is a just health system, and how might we achieve this?
Thank you very much. Well, you have said from a legal angle, but I also want to look at it from the society and the local community angle. Because when you go into the local community, a lot of people are there and they rely on their resources within the community. They go about their daily lives in a very simple way. But we know also that because of a kind of sophistication that has happened all over the world, we have a lot of greenhouse gases that has gone into the system, and now we're experiencing climate change. These are people who did not cause climate change, but now they are bearing the brunt of it all. So how do we help them? How do we deal with the work? For us as activists, first of all, I will talk as an activist. I've been in the activism for climate change in the past 15 years, and I've been in this COP for several years. And we have had so many activism at the UNFCCC, inside UNFCCC, and even outside the UNFCCC. Most of the things we keep asking the developed country to do is be responsible for your greenhouse gases. Provide finance to address what is happening in the developing countries, because we are bearing the brunt. I am from Nigeria. We see all that has happened. Even in Lagos, we see what is happening. We see sea level rise. We see our houses being destroyed that are along the coastal areas. And recently this year, we've seen a lot of flooding in our countries. Who are the people bearing this brunt? It is the community people. They are bearing the direct impacts of climate change. And what we are saying in terms of climate justice is that these people deserve justice. And what does justice mean for them? Justice means that they have the necessary resources to address the impacts of flooding that comes upon them, that destroys their livelihoods. And if they have that finance, then they will be able to get restored back to what their normal situation before the flood came. But right now, at these negotiations, are we having enough finance to deal with that at the local level? Even when we're talking about climate finance, is it getting back to the local people? And then, if we look at the flooding that is happening, we have seen that if we have that kind of flooding, a lot of things are disrupted, people's livelihoods, people's businesses, and even the potential to have disease spread as a result of this terrible flooding is really there. In Nigeria, as we speak today, we see a lot of people going through this. For instance, in Bayelsa, a part of Nigeria, as we speak today, we found out that the flood is washing away dead bodies from their graves. And we know what that means for the local community. And we are here, we are discussing finance. We are here, we are still discussing for over 10, 20 years, and nothing is getting to those local people that are there. This is quite a big injustice. And the only legal way to correct it is for us at this COP to deliver climate finance to the local people on ground. Not only to deliver it, let us have climate resilience infrastructure that will help them address issues of flooding, because if we have good climate resilience infrastructure, it will, to a very certain to the certain extent, help to reduce the kind of impact that will come upon the local community. So, but then government itself in the developing world needs that finance also to deal with that, and that's why today Lagos State came with their adaptation plans, resilience plan, that this is how much we will need. And the cost of inaction is going to cost Lagos State $30 billion. So we are supporting as civil society, we are supporting our government to get the needed finance and to be able to help our local men and women address the impacts of climate change on the ground. Thank you.
Thank you very much. Thank you. So, Abby, I'll come to you in a moment to think about what a just health system might look like. But I wonder if I can come back to you, Professor Abayomi, just particularly on those issues in relation to Nigeria. From both speakers actually, thinking about the particular issues that are happening in Lagos and wider Nigeria, and in relation to the discussions around financing, if you'd like to respond.
Yeah, I think that, you have, I mean, I represent government, and the last speaker, myself and Dr. Fashawe represent government, and the last speaker represents the community. And you know, what we're doing in government is to try to bridge that gap so that it's not the governance on one side and the people on the other side. So for example, the last speaker actually sits on a civil society desk in the Ministry of Health of Lagos State, so that we get this kind of information and we get this kind of emotion that's coming out of the community, so that we're sensitive. Sometimes you can be, in government, you can be a little bit displaced from reality, So it's important that we are in touch with the civil society organizations and that we're getting real detail of what is happening at the community level. Something as simple as what she just spoke about, that graves are being eroded and, ancestors are being washed away in rivers. I mean, that's a very culturally sensitive area. Wells are being salinated by sea excursion. We may not know that at the government because we're just looking at the numbers of wells available to the community. But then the people who are actually using water can now report to us and say, well, the water is there, but the water is not fit for human use. And that becomes an intervention for government to see how can we dig deeper wells or boreholes, or how can we put water filtration systems on the well. So essentially, we as government, we can't wait for shocks. Government's responsibility is to predict, to know, and to anticipate, and to put things in place. So we all know that climate change is coming. We all know that as a collective humanity, we're not responsible enough to avert disaster if we don't do anything major soon. We know what the modeling is. They've given us 9 years to cut emission. Otherwise, we're going to go past the threshold. So as government, we need to be sensitive to these international modeling data, and we need to anticipate what we need to do as a collective, but we also need to know what we have to do in our immediate environment. And so, you know, we need to, in Lagos, we know that we're vulnerable, so we're going to build strong health systems, and we're going to do everything we can to finance those systems, whether it's local funding, whether it's adaptive insurance funding, whether it's tapping into the Global Climate Fund, which is why we're here. And we've already established a whole consultancy group in Lagos State, because tapping into global climate funding is very, very difficult. You know, it's not easy. You have to know exactly how to access these funds, you know, and the funds are not abundant. So, you know, the person who has the best proposals is the one that's going to access the funds. So we've put a team together in Lagos. The governor has approved it as a team of high-level environmentologists who actually know the inroads of the Green Climate Fund to help us access these kinds of funding. Thanks.
Thank you very much. Thank you for giving that perspective on this. Dr. Deivanayagam, if I can move to you. What does a just climate and resilient health system look like?
Thank you so much for having me. Vanakkam, Sharm el Sheikh. So I'm Tamil. I'm from Sri Lanka. My parents lived there, and I moved to the UK when I was 10 years old. So I come from Sri Lanka, which is one of the most climate vulnerable islands. It's an island, so it's vulnerable anyway, but it was also made vulnerable by actively eroding the country through 3 different colonizations, ethnic divisions that has led to a civil war, and also that has led to the country being past the point of adaptation. And that's my homeland, and I was born in India. And that essentially, for that experience has made one thing that very crystal clear for me, and that is that the system that we live in is making us sick. And this is an issue of sick systems. And the health system itself has been built off the backs of slaves, imperialism, colonialism, and these are the systems that we as health professionals are still working in. So it's no doubt that a system that is built on these foundations will tend to throw neo-colonial solutions at climate change. So I think, what does a just and resilient health system look like? Of course it looks sustainable, of course it looks green, but what is the point of a more green and sustainable health system that doesn't allow refugees to access healthcare? And what is the point of a sustainable health system that criminalizes people who are accessing mental health? So I think it's important for us to really look into the deeper disease that is making us all sick. And Dr. Rupa Maria and Dr. Raj Patel put it beautifully. They say that climate crisis is a symptom of colonial capitalism. And I'll go into what those 2 things mean for the audience. So colonialism is a world order that is built on hierarchies, and capitalism requires endless growth and accumulation of resources in the core, so that is areas of wealth, but that requires the sacrifice. And this right now, people who are being sacrificed is the global south, the working classes, migrants, women, children, older people, as well as disabled colleagues. But not only people, but what capitalism and colonialism does, it erodes the relationship, that delicate balance that we have with our non-human kinfolk as well. And our non-human kinfolk, as in nature and people other beings on earth that we share this space, this sacred space with, they're already talking to us and telling us that planetary health is suffering. So for me, a just and resilient health system means looking at the systems that are making us sick in the first place, and that includes the health system, the modern biomedical Western health system that operates all around the world, and really challenging that, structurally as people in the institution, but also building something beautiful and alternative in the communities that we work in, so that that transformation will look absolutely irresistible to everyone in the institution. So that's what a just and resilient health system looks like and feels like to me.
Thank you very much. So we have about 20 minutes left for this panel discussion, and I wonder if we could move a little bit more into actions and what we might do for the people here in the audience, for the people watching online. So, particularly situated in your own organizations, positions, locality, can you think of some tangible actions that you might take forward, that you might encourage others to take forward? And also some of the barriers you might face in doing that, and how you may overcome that. Dr. Fasawi, if I can come to you first with that question.
Thank you, everyone. When we talk about tangible action, it means we can measure impact right there and then. And I'll give an example of a project the Environmental Protection Agency is currently running in Lagos. It's called Eco Clean Air Project. The lady from World Bank, who spoke earlier on, assured us that we have access for technical support and financial support from World Bank. I quickly spoke to the doctor and said, give me her details, give me her details. And what we're basically doing, I'm a scientist, so we have to have objectively verifiable indices and results. We go into a community, advocate against cooking with fossil fuels, firewood, don't cut down trees. We need trees to sustain the temperature. At the same time, cooking with firewood is hurting you and your child, and it's causing global warming. However, if the government takes the firewood away from them, like she said, the colonials, those ones, and are on the other end of capitalism, they do not have money. How do they feed? How do they cook? So Lagos State government has been magnanimous enough to say, give me your firewood, I will give you a gas cooker. We use LPG right now, liquid purified gas, and we hope to move to CNG. We also hope to move to biomass from animal and cattle rearers and all. We're progressing. Now, this project went into a community, did that, and we measured knowledge, attitude, and practices. We measured air quality real time for a month with machines. And in 4 weeks, we went back there and did the same. And we could measure the impact. It was clear the air quality was better. There was less, the prevalence of air pollution-related diseases went drastically lower. Visits to the hospitals were less. Even we went ahead to educate primary healthcare physicians that don't just treat these children for air pollution-related diseases, educate their mothers about how, like she said, our own activities, anthropogenic activities, we cause these problems. We can't just hold government responsible. We also have a part to play. And that is a way in which we're tackling some of these issues back in Lagos, Nigeria. Thank you.
Thank you very much. And this is a topic that's very close to my heart. I worked on air pollution, measuring levels of air pollution, and in my clinical work, treating children who have respiratory infections. And the effects of air pollution are incredible. Very, very high levels that cause numerous health problems for young children in particular. Yes. So thank you for giving that very real example of what you've been doing. Mr. Akosa, can I ask you the same question for a tangible example and any barriers you might face?
Well, first of all, what does taking action means to us? I'm going to talk from a civil society perspective and then linking it to the global climate conversation. This is very, very important for us. We must continue to remind the developed world that they are the cause of climate change. If care is not taken, they forget it. And that is what is happening in these negotiations. They continue to push the responsibility back to the developing countries to do all the actions, to take all the actions, to try to mitigate, but yet they are not talking to themselves to mitigate. So we must join hands with our government to continue to remind them of the historical injustice about climate change and we need climate justice. Very, very important. That is number one, and at the global level. At the local level, we join hands with our government to take climate actions. What does that mean? We create awareness, we support their project implementation and ensure that these projects that onto become very, very successful on the ground. For instance, we are working with Lancet to implement the air quality projects. We have young people who are helping them to monitor air quality in Lagos State. That is one action we are taking on the ground. And then we have to sit down there also as civil society to hold government, our own government, accountable to ensure that what they said they are going to implement on the ground, they actually implement it. So we have two ways. We hold government accountable at the global level, and we hold government accountable at the local level. These are very, very important things so that we continue to make that connection from local to global. And at the end of it, what do we want? We want climate justice. Thank you.
Thank you, and possibly to Professor Abayomi, who's working at the local level in Nigeria. So what might someone do, and think about the audience here, people online, what are the actions that they might do as well to help create resilient health systems wherever they may be?
So I think that, generally speaking, around the world, when we look at human development and human evolution of consciousness, it's a collective. There needs to be a critical mass of collective harmonization of thought. And until that happens, we're not going to get anywhere. There needs to be enough people singing the message that you just heard Ms. Akosa talk about, recognizing that the planet is heating up and it is an existential threat. If we go past the threshold in the next 8 to 9 years and we're unable to turn the dial down, we may disrupt the planetary health in such a way that it cannot recover, or it might fight back in a way that we can stand. And if we don't recognize these factors, I think we are on a terrible trajectory. So how do we all, so everybody has a sphere of influence, whether you're in government, whether you're at community level, whether you're just a person that is attuned to what's going on in the world, and you can influence what you do by enlightening yourself and doing whatever you can in your sphere. You may be at the community level, you may be an activist, or you may be a government official, or you may be an academic. I think there's no point talking about how to get rockets to Mars and the moon or whatever if the Earth is going to blow up. We really need to turn our attention to what's going on right here at home, and we need to find solutions to the problems. And everybody's contribution, even if you're just planting 1 tree a year, that is a contribution. There are 200 million people in Nigeria. If every Nigerian plants 1 tree a year, that is a significant development. And I'm just talking about a very simple example. So I think what civil society and activists must do is they must continue to remind us, they must continue to remind the population, they must continue to remind humanity that collectively we must raise our level of consciousness and do what is right. And I think that's all I can say at this point.
Thank you very much. And it's incredibly important, isn't it? Everybody has some actions they can take. They may be relatively small actions, but they can also push the cause. They can speak to people who are in power, who can make changes and influence those people. So everyone has power within themselves and within their communities. Abby.
Thank you. So there's three things, three practical things that some of the work that I'm doing involves, which I would love for everyone in this room to learn about and potentially think about working with us as well. The first thing is about anti-fossil fuel work, and that is something that we all have to do. It is an absolute scandal that some countries in this world are spending more subsidizing fossil fuel companies than their own health budget. Right? Some countries in this world are doing that. That is a scandal. And we must remember also that those who started this fire are not going to put it out. So do we invite the tobacco industry to help us solve lung cancer? No, we don't. Then why are we inviting 640 delegates from the fossil fuel industry to solve climate change? This is literally salt that we are pouring on our existing wounds. And remember also, like we talk about racism and colonialism because it's, it can't be divorced from climate change. So that means divesting from fossil fuels also means divesting from white supremacy and other hierarchies that the fossil fuel industry and that power that it wields. So it's not a business opportunity. We have to get that in our heads. It is about love, and it's about abundance that isn't money. There's always this idea of scarcity that we have in this world, but we have enough in the world. 92% of the countries in this world, 92% of emissions that are in excess of our planetary boundary is from the global north. So this isn't about scarcity. We have enough love, we have enough resources to go around. So the first action is anti-fossil fuel action. My colleague, Titi, mentioned about instead of countries delivering loss and damage in this conference, they're talking about insurance schemes. And instead of climate finance, they're delivering more predatory loan agreements. So we're going to end up with more debt in the global south. So, and this, recognizing that this is neocolonialism and calling it out as a health community is really critical. The second thing, so one is fossil fuel campaigning. The second is joining the dots. So companies will weep for their money, people will weep for their families, people will weep for the polar bears. But why are we not weeping for Ella Kissy Deborah, who died from air pollution in London? And why are we not weeping or pouring our hearts out for Chris Kaba, who was shot dead by the Metropolitan Police in London? All of this is connected, and it's these systems that we as health professionals should be dismantling at the same time. Everything is part of health justice and just health systems. And also, why are we not weeping for Alaa Abdel Fattah, who is in jail on hunger strike just a few kilometers away? So it's about connecting the dots. And what I do and the work that we do as part of MedAct and Race and Health is we work with many different grassroots groups to build power from the ground up, because we know that we are at war, essentially. But while we're at war, we are doing it with a lot of peace and clarity. So we have clarity in who the perpetrator is. We have clarity that it's corporate colonial control from fossil fuel industries. We also understand that our ability to imagine solutions has actually been stolen from us. So what we're trying to do is make spaces for imagining community-led solutions. And I'll tell you exactly how we're doing that. And also at Race and Health, we're putting young people and most affected people in areas at the forefront of this, because young people seem to be able to understand that something that can be made can be unmade quickly as well. So that's why we believe in the power of youth. So practical ways of how we're doing some of this work. And we're doing it collaboratively and not looking at issues in isolation. So we are part of an organization called the People's Health Tribunal, and that essentially is a global forum for testimony and reimagining and listening, where we are specifically looking at extractive industries and how they impact on health. It's taking place in April 2023, specifically targeting 2 petrochemical companies across, operating across the African continent. So we are working with our colleagues from the Niger Delta, from Nigeria, from Stop Yakop across Kenya, Tanzania, and Uganda, so that they're in the front lines of telling these stories and how they're resisting, so we can all support them. So that's the People's Health Tribunal. Some other work as health workers, so there's a poster outside that says health workers demand climate justice. So I'm part of a group called Health for a Green New Deal, which is a MedAct campaign where health workers around the UK are mobilizing for a Green New Deal. I don't have time to go into what a Green New Deal is, but please read it, and we have action cards that I can give you as well. And essentially, there's lots of organizations that are building power together, and that's because we're stronger together, and also real change is happening from the ground up, and we're also working within these institutions to push for that transformative change that we know that we can get if we act in solidarity. So that's working with migrant groups, working with workers groups, working with people who work on racial justice, and as the health community, using our power and voice to act in solidarity, as opposed to just adding things, oh, let's add health to the agenda, let's add health to the agenda. Of course it's important, but what can we as health people do to offer our voice for all these people who are working in the communities already? So those are the 3 things. Fossil fuel action, act in collaboratively and in solidarity, and the People's Health Tribunal is the thing on storytelling, and that allows us to imagine solutions that are erased and have been silenced.
Thank you very much. Thank you for that very powerful speech. We now have a number of questions from the audience, and I wonder if I can just read out some questions, and if any of you feel like you can answer them, please let me know. So what are some of the priority areas that young health professionals can get involved in to advance climate and health justice? Would anyone like to respond to that question? Yeah. Well, what are some priority areas that young health professionals can get involved in to advance climate and health justice?
Thank you very much. I spotted a young doctor who I am very proud of. She's from the UK, but she works in South Africa as well. We had a project in partnership just recently. Hello, doctor, can you wave your hand? And what she had done was ingenious. It was run for clean air. We had people moving for health purposes. You have to walk, you have to run, you have to get your heart pumping. At the same time, holding handheld air quality monitoring devices. That way we got data, a lot of data, and we got people to start to understand the benefits of exercise. So there's a big nexus between health and environment, and I'm happy that we have her right there. I think we should give her a round of applause. That was really ingenious. And it's been successful in Lagos, and I think she has many other states in Nigeria where that project will go on. And those are some of the projects that are going on. Thank you.
Thank you very much. Can we move on to the next question? How do we ensure that adaptations to health systems in the interest of resilience prioritize minoritized people? Because sometimes these things can be, they can disadvantage the people who are most affected as well. Any changes? Please.
So I think as government, maybe I should take the lead on answering that question. Yeah, I think, as I said earlier on, it's important that governments remain in touch with reality. And one of the best ways to do that is to, first of all, come to events like this, to engage with activists and civil society, because it's very easy to get carried away with governing, but you could also go down the wrong pathway because you're not getting the feedback. And life is all about action and reaction, feedback and commitment. So it's important that we remain in touch with the people. Social media I think is advancing that opportunity, because as government officials, we're subject to social media tsunamis or social media barrages of information. And you also need to have, in government, I find that you need to have a desk that really deals with social media, because a lot of information comes in. Some of it is good, some of it is aggressive, but it doesn't matter. All information is good, and you can filter that information. You can get information from your activists. You can get information. I've learned so much in the last 3 or 4 days here, and I've been in climate change for 20 years, and I'm still learning. So it's important, that you come here. And it was here that I learned about the great initiative by the WHO called ATTACH. And even though we've been doing a lot of the components of ATTACH in Lagos already, because I believe Lagos is a very sensitive and responsive government, but it was nice to see that the WHO have really embellished the concepts of ATTACH. And now we have a platform that we can go out there and say, we're not doing what Lagos said you should do, we're doing what the WHO said you should do, which is great for us as a platform. So I think as government, we just need to keep our intelligence flowing in and be sensitive to the needs of the people that we're so responsible for.
Thank you very much. And I wonder if the other panelists would like to come in on the same question. How do we ensure the adaptations to health systems in the interest of resilience prioritize minoritized people?
Yeah, well, I think the most important thing here is for us to pay attention to stakeholders' engagement. This is very, very important, because when you want to have a project or whatever you want to do, there are different stakeholders. Their needs, issues, and concerns are always very different. So you take all their needs, you take all their issues, and take it into account as you begin to design your project, as you begin to do your thing. So that's the only way we can get the vulnerable into it. For instance, in my organization, one of the most important things is we ensure that the voices of the vulnerable, the marginalized, are mainstreamed into policy processes in government or anywhere we find ourselves. So most of the time when government is bringing out their own position, we are also consulting with the communities. We are asking them, do you think this will work for you? Do you think you need this? Or is this a top-bottom issue that government is just imagining that this is what you want, it is not what you actually want? And then we also go to the vulnerable areas, because when you're talking about making sure that the vulnerable people are actually addressed in policy issues and in implementation of actions on the ground, you need to go to them. You need to talk to them. You need to experience what they are experiencing. Then we need to hear their voices. And we also make sure that they are on the table, at the decision table. And that is what we find that is lacking in here in COP. Most of the time we have all the policy people on the table. And where is the voice of the marginalized on that table? And what they tell us here is that it's very technical. They discuss these issues above our heads. We don't understand them. A local woman does not understand your negotiations. All she understands is, I want climate justice. I want my livelihood. I don't want my systems to be disrupted. I should be able to do my business. I should be protected from the floods. And even if I have problems and my livelihood is destroyed, I need money to come back, to recover from all those things. That's all they want. They don't want to understand all these technicalities. And we must meet them where they are. I keep saying it. If we are not careful, a lot of vulnerable people may be left behind if we don't do the right thing. Thank you.
Thank you. Would you like to come in?
Just really quickly, in terms of how to ensure that minoritized people are involved in adaptation. So in the UK health system, there's no real adaptation plan for climate change, which again is a scandal. And what we as a public health workforce are doing is I'm working with the Faculty of Public Health, and the faculty is working with government to try and ensure that we have the right adaptation plans for the heat waves that we will continue to experience. So working with the government, working with the institutions that have a seat at the table at government, including the Faculty of Public Health. The second thing is about accountability. So how do we make sure those minoritized voices are at the center of this? Nothing about us without us. So that's something that's, you know, what Indigenous folks have told us for a long time. Nothing about us without us. So ensuring that they have a seat at the table and at the center of the table. Because our Indigenous friends, ancestors have shown us that they have survived crisis after crisis after crisis over thousands of years, and they have the solutions to how to survive the climate crisis as well. So therefore, accountability should rest with the people who are most affected when we're making adaptation plans. And then the final thing is, again, the importance of stories, and that's why testimonies are so powerful, and that's why citizens' juries and people's health tribunal, the things that we're organizing so that we make sure that those solutions are at the front, are a really great way to make sure that when we're planning for adaptation, the people's voices who are silenced are heard. So yeah, a tribunal or a jury would be a really good way to do that as well.
I just want to take up the point that Ms. Akosa mentioned. You know, there's one thing about putting funding into the green climate financing mechanism. There's another thing accessing it. Even if you think that civil society, it's complicated for civil society, it's complicated for everybody. It's complicated for governments to access these finance. You need specialists who actually understand the back end of this mechanism to actually write it in such a way to access the financing. So, and I think that's a ploy, you know. So there's one thing, the green climate finance is not being fueled enough. That's the first thing. And the second thing, whatever is there, you need to be a rocket scientist to access it. You know, and that's just not fair. You know, it shouldn't be that way. It's really encumbering the South from accessing these much needed resources that are going to supplement their own resources to achieve the same objectives. Thanks.
Thank you. And if you have any other questions, we have maybe time for one or two more questions. Please do submit them online. Can I shift slightly to talk about financing? So there's a question, how would climate financing support achieving just and sustainable health systems? How would climate financing support achieving just and sustainable health systems? Would anyone want to come in on that one?
Thank you very much. Like she said, it is criminal at how much government throws at fossil fuel manufacturing and distribution compared to how much we put into our health budgets. It's just the same analogy. When we start to look at climate financing as a legislative and executive law, all the civil society organizations will be giving governments, developed countries, a round of applause every day. They would not be on the other side of us. And like my colleague, Ms. Akosa, said, I also do a bit of civil society, but it's really very difficult, like Professor Abayomi said, to be government and civil society. When we have adequate climate financing from developed nations who have caused most of the damage to the climate, who are helping our temperatures rise every day, and you bring us to Paris and to Montreal and say, all of you sign, by 2050 we must hit net zero. Yet, you're emitting 80% of of NOxes and SOxes into the air, and you expect us to put in the same energy you're putting in when our people don't even have food to eat. That cannot work. Climate financing from the people who are damaging the climate, or who even have more economic powers, who have colonized us and have kept us there, need to start sending money to Africa. And that is why I'm actually very excited. And I hope other Africans are, that COP is happening in Egypt this year. And I hope we're thinking and we're talking to the developed nations. We're talking to them that climate financing is the way to go. And not for yourselves, but to us, the underserved, the underprivileged, the colonials. I was shocked to hear how much and how many numbers of fossil fuel manufacturing or developing companies are sponsored here, compared to giving people who are suffering these green funds. Yes, climate financing will help, and it will help a great deal. And it must come from the people who are rich, who have caused climate change, who are constantly increasing the temperature of the globe. We contribute in Lagos only 3% to global warming. Not in Lagos, in Nigeria, 3%. And you're expecting us to put the same amount of energy and funds into net zero. It just can't work. Climate financing from, I don't want to say you all, from World Health Organization and co is what we really need. Thank you.
So I just want to come in quickly and play the devil's advocate here. So one of the reasons why the rich North are a bit hesitant to compensating the South is because they say there's a trust deficit in terms of financing accountability. So we can't keep shouting the same message, you know, put more into the global fund, put more into the global fund, when one of the biggest reasons they're saying they're not going to do that is because we can't account, we don't have fiscal and fiduciary accounting systems. So I think we need to address that issue as a South, as a deprived part of the world, because otherwise we're just going to be going around in circles. How do we, as the or developing part of the world, address that constant question? And what must we do as governments in the South to make sure that we are building accountable and systems and diminishing that trust between governed and the governments?
Can I come
There
in?
are questions. There are a lot of questions that have been...
No, go for it. Do you want to go?
Okay, let me quickly
You
go on
respond
to
and
it.
I'll
There are
after.
so many things that are on the table now, but I'll take it one by one. Yeah, how can climate financing help build resilient health systems? It will definitely do a lot for us, especially in the developing world. If we look at our primary care centers, secondary facilities, some of them needs revamping, some of them need actual destruction, destroying them and rebuilding a model one that is fit for purpose. And we have seen what Lagos State is doing in that regard. So we need a lot of financing to do that. Climate change to help us build resilient health infrastructure is very, very important. And we cannot do that without good climate financing on the table. That is number one. Then number two, how do we look at the issue of human resource for health? We need to continue to train our medical doctors to be able to respond to emergencies and shocks that the impacts of climate change will bring. And there are different initiatives now on the table. The world now is beginning to diagnose what we call climate change as a disease. And now we are beginning to train climate doctors who will be able to look at that. And again, we have a very robust traditional medicine in the whole of the global South. And this is a whole, what they call it, a whole pool of knowledge that we have not tapped into. And we need a lot of financing to be able to tap into it and to make it very standard so that we'll be able to share this knowledge with the whole world. And you know, one good thing about traditional medicine is that it brings to us nature-based healing on the table. If we carefully look at it, we need financing for that. We need financing also to look at some of our herbs that is going into extinct. How do we continue to preserve them? How do we preserve our forests? So that when we diagnose forest bad for people, people will have forests to go into. But now we are being faced with a lot of deforestation. So how do we deal with deforestation? We need finance to deal with that. These are very, very important things we need finance for. And this will help us build a resilient health system. If we look at orthodox medicine, traditional medicine, and we pull all this together, and we're able to deal with the impacts of climate change, do you know what that means for us? It means that we are going to have a resilient system. Thank you.
Thank you very much. We only have a few minutes left, so I want to just give you a summary of some of the comments that have been coming through online. I'll just mention a few of them. So we need to better link, so this was in relation to what a just health system could be like and what steps we need to take. We need to better link gender justice to health and racial justice by taking an intersectional approach that recognizes the compounding for created vulnerabilities and intersecting forms of discrimination. Don't just focus on health systems, also need to focus on mitigation, for example, air pollution killing 7 million people. We need more data that's disaggregated by forms of identity to move the health community beyond discussions on air pollution and public transport to focus on health equity. We need to commit more funding and more ambition to adaptation, which is more often where we find issues of health and human rights. Lack of action on adaptation maintains health inequalities. So thank you for these comments. I wonder if I can come to each one of the panelists for one last time, just a final closing thought in 1 minute if you can. We'll start here with Professor.
Well, I just think that the South need to get together and form a collective. As I said, we need a threshold of force. We need a threshold of understanding. We need to raise our level of consciousness as human beings and understand that you can't keep interfering with Mother Nature. Mother Nature will kick back, and sometimes, irrespective of our level of innovation and technical abilities, we may not be able to withstand a Mother Nature kickback. So I think we've seen evidence of what that looks like in terms of the way the environment is behaving, the way COVID dealt with the entire globe. And I think these are just early warning signs, and we should and need to take heed.
Thank you very much. Abby?
Thank you. I think it's really important to look at change beyond this 2-week conference, and also remembering that solutions that we throw at the climate crisis, so long as it's still based on greed and so long as it's still based on a business opportunity, we're not going to achieve justice and equity. And the master's tool is never going to dismantle the master's house. So that means that we have to throw completely radical solutions to this, and that means working together, working in collaboration, and challenging one another, but also ultimately taking care. There's not enough care and love in this world when we're doing these negotiations. If we took one moment to really look into someone else's soul and understand that we are all humans, then we might perhaps look at these negotiations slightly differently. Also, I'd say the main thing is make justice your starting point as opposed to an afterthought. And this means that, again, doing climate work also means doing human rights work. It also means doing work to free Allah from prison. It also means doing prison abolition work and police abolition work. I'll stop there.
Thank you. Dr. Fasari?
My closing statement is health is wealth, and the proportion of your wealth is not anything if you're not healthy. One. Two, the level of your environment is directly proportional to the level of your wealth. Three, it is a collective responsibility. The environment has no boundaries. That is the only thing the whole world shares in common, oxygen. And the other day, there was some nuclear accident in Russia. And in South Africa, they were picking radioactive substances in the air. And like she said, if it continues to be a profit-making thing, business, I want to sell air quality measuring machines, not because I want to prefer a solution to Nigeria, but because I want to make profit out of it, it's going to still be business as usual. I like the fact that she keeps saying love. It's strange in a technical session. However, the truth is, let's love ourselves, let's love the environment, and let's continue to know that this environment was given to us to hold for generations unborn, our children and our children's children. We need funds, and we need funds. Thank you.
Yeah, I think I just have a short statement. I want us all to understand that delivering climate finance at scale to build a health resilience system is part of climate justice. And what we want is climate justice. Thank you.
Thank you very much. Thank you to all my speakers today. It's been a wonderful panel. I've learned so much. First, we had Professor Akin Abayomi and Ms. Christina Romanello, who gave our high-level talks, and then joined by Dr. Fasawe, Ms. Titi Akosa, and Dr. Abi Deivanayagam. Thank you very much for joining and teaching us so much. And thank you to the audience who are here today and online. We have a short evaluation and survey, and if you're interested in filling that out, they'll be available at the back. But thank you very much for joining and giving us your thoughts and comments as well. We've covered so much in this session. Local issues, flooding, air pollution that affect individuals. We talk about the health systems, the regional issues. We've talked about macroeconomics and politics, all in the context of the history, and particularly the colonial history that we've discussed so much, and how that's playing out outside here in today's negotiations. The focus on the most minoritized, increasing representation for people who are most affected is essential. And the fact that fossil fuel companies influence the agenda more than billions of people in the world is frankly astonishing. Health has to be central to discussions on the climate, and a just health system is not just important, it's essential. Thank you very much for joining us today.
Bag con.